then we'll have our first bill hearing. Welcome, everyone, to this meeting of the Health and Government Operations Committee. Please do not forward the Zoom link for these hearings. Staff will not allow anyone who is not invited to testify into the hearing. I ask you to encourage people to watch the hearing on YouTube instead. The bill sponsor or designee is allotted 5 minutes to present the bill. For Senate bills, everything today is a Senate bill. One witness will be allowed to speak for 2 minutes in support. Please stay in the hearing until the delegates have had an opportunity to ask questions. One witness will be allowed to speak for 2 minutes in opposition and then respond to questions if anyone has signed up. Please conclude your remarks when you see the timer finish. Members must remain present with your video camera on during the entirety of the hearing. Members, and to remind you, please ask only one question of one witness. If you have other questions, you may follow up offline. Please use the raised hand function to indicate that you have a question. Our first bill is Senate Bill 837, Health, Advanced Care Planning and Advanced Directives. Senator Kramer, welcome to HGO.
Thank you for that, Mr. Chair. It's a pleasure to be here with HGO. And colleagues, I have had the pleasure to represent the Senate on the State Advisory Council on Quality Care at the End of Life. I'm guessing many of you didn't even know that such a commission existed. The council is comprised of very talented people, well-versed in the issues that the council addresses. Its members include hospital emergency room physicians, hospices, physicians who are private practitioners, seniors advocacy organizations, and healthcare specialists, just to name a few, and they all cover a wide spectrum of interests. Last year, in response to a request from the Senate Budget and Tax Committee and the House Appropriations Committee, the council focused much of its efforts on developing a very thorough report with recommendations to increase the number of residents who have completed advanced directives and the best practices for making the directives readily accessible when needed. And that's key, readily accessible when needed. Less than half of Marylanders have completed an advanced directive, and the numbers of our minority residents who have done so is a fraction of that number. The bill before you represents the work of the council that requires legislative action. So what does the bill do? It requires that the Maryland Healthcare Commission coordinate with a broad range of healthcare entities in the state to promote and facilitate the use of advanced directives by our residents. It also requires insurers, nonprofit health service plans, and HMOs to offer advanced directives to their members or enrollees during open enrollment and periodically thereafter. As mentioned, the council has a very broad membership of representation in the healthcare fields, and as such, the bill has very, very broad support across those interests. The work of the commission in preparing the bill was thoughtful and deliberate and is intended to educate the public about the importance and value of advanced directives and to provide a common computer system for the advanced directives to be uploaded so that wherever a person may find themselves in an emergency, the directive can be found by a physician should it be needed. The League of Life and Health Insurers is opposing the bill, and in doing so, have represented that passage of the bill would somehow limit the options of Marylanders, but their logic is lost on me. With passage of the bill, a person can choose to upload any, emphasis on any, advanced directive form that they choose to use. It can be a form from the Maryland Attorney General's office, which I've been told is an exceptional one, or it could be from a faith-based organization or a form online. It simply doesn't matter. The only limitation is that the form is being uploaded to the computer system that has been approved by the Maryland Healthcare Commission, because the system meets all of the requirements and standards, including, and very importantly, security, that the commission required. And that was a consequence of legislation that I believe Dr. Dan Morheim, as a member of the House, sponsored to create and require that this computer system be developed. Additionally, the Maryland Hospital Association has very disappointingly opposed the bill on the basis that the bill circumvents their efforts to promote advanced directives. It does not. Hospitals will be able to do what, if anything, they are doing now. They'll be able to continue to do whatever it is. This bill does not change that. The bill does provide that the Maryland Healthcare Commission will coordinate the implementation of advanced care planning in the state, including actions to be taken by hospitals to encourage people to create advanced care directives and encourage people to create advanced care directives. And the hospitals are opposing that, I assume. And in summation, committee, the bottom line is that the insurers and the hospitals don't want to be troubled. But colleagues, I would proffer to you that the public value and importance of increasing the use of advanced directives far exceeds the desire by the opposition not to be bothered. Mr. Chair, committee, I thank you for your time and ask for a favorable report on this bill that passed overwhelmingly both in the Senate Finance Committee and on the Senate floor. Thank you.
Okay, the next witness, Senator Kramer, the next witness in support is Elizabeth Claiborne.
Hello, everyone. Thank you so much for having me here today. I'm honored to be able to speak on this bill. I actually rearranged my clinical schedule. I am an emergency medicine physician that practices in Prince George County. I have an adjunct assistant professor position with the Department of Emergency Medicine at the University of Maryland. And although today I'm talking about my own personal experiences as a clinician, I will let you know that this is an area that I am passionate about. My academic focus is on ethics, end-of-life care, and I specifically do teaching to all our residents and medical students about the importance of advanced directives. So I was so pleased that we have actual legislation that can make a real difference in what I can do to help patients. Just to paint the picture, this morning when I came into work, I had a patient that had recently been admitted to another hospital. He had a history of esophageal cancer, was doing very poorly, could not speak for himself. The forms that he came with from home were different from what the family members told us and were different from what the previous hospital had said in regards to his advanced directive. It's these kind of miscommunications and difficulty in accessing information that makes it so critical that we pass a bill like this that can basically eliminate the troubles that clinicians have when it comes time to making really important decisions in the first minutes of patients arriving. I think an electronic advanced directive that can be connected to CRISP gives clinicians like me the information that they need to respect patients' wishes, to make sure that we're not making a mistake, and that makes it easier for family members to know what's going on as well as their entire healthcare team. Again, it is something that as an emergency physician in the era of COVID, I cannot emphasize enough how important this is. I would encourage all of you personally to think about, have you done your own advanced directive? How have you alerted your family? And how is that easily and readily accessible to your healthcare team and to others? I find this to be an excellent piece of legislation that really hits the most important points when it comes to providing a comprehensive access to important information. And I have looked at some of the opposition and agree with Senator Kramer that I think they're just misunderstanding what currently exists. I'm happy to answer any questions about this. And I would ask all of you guys to really think about this and support this bill favorably. Thank you.
Thank you, Dr. Claiborne. There is a question from Delegate Cullison.
Thank you, Mr. Chair. Senator, how do you envision the notification piece? Are you thinking of a separate mailing, or is it simply including links that a person might use with an explanation in the information that folks get about open enrollment when it refers to a carrier, and how do you envision notification in other ways?
Well, I think that that the purpose of the bill is for the Maryland Healthcare Commission to develop what that process will be.
Okay.
They're the ones who, are most familiar with it and how that will best be implemented. And the bill provides that working with the insurers and the hospitals, that they'll figure out how best do we communicate that. Now, quite frankly, in the hospital setting, it's the physicians who do that now. They're the ones who really are the direct link to the patient, and this, measure to facilitate advanced directives. And MedChi is strongly in support of the legislation because they recognize it's their members who are the ones that are on the front line doing this, and the value and importance of having it done. But the bill is not prescriptive about how that will be done. The goal is leave it up to the folks who know best to work with the entities to facilitate a thoughtful process.
Thank you. Thank you, Mr. Chair.
Delegate Hill.
Thank you, Mr. Chair, and thank you, Senator. It's good to see you on this side of the world. Oh, I guess we're still on different sides of the world. Anyway.
Hi there, Delegate Hill. Good to see you.
So I get a notice from my life insurance company and my disability every year asking me, do I want to update my my beneficiary? And that's pretty automatic. So is that similar to what you see, that people are offered the opportunity, they don't have to take it, and then every year when they re-up their insurance, they're asked, do you want to make any changes in your advanced directives? And then it's just held in this central repository. And if they show up with something dated more recently than what the electronic, that would supersede the electronic advanced directive?
I believe you're pretty much spot on that. Yes, the idea is keep the recollection that you have an advanced directive in front and, on the front burners, so that people don't even forget that they did it years ago, and that periodically, you may want to take a look at it and update it just so you remember that you have it. And yes, whatever most recent would certainly supersede what had been done previously. And as Dr. Claiborne was saying, it also gives greater access so that an emergency room physician who is suddenly faced with, do we, take heroic measures to keep this person alive? Is that their wish? There's access to that advanced directive so that they know the wishes of the individual. And, Dr. Dan Morheim, a former member of this committee, has a chilling story that really hits home about when he was, first practicing, and there was a woman who came into the hospital, and she was in failing health, and there were, the hospital was using heroic measures to keep her alive. And Dr. Morheim walked into this waiting room where the family was fighting over what to do with their grandmother, their family member. And some were saying she did not want this. Others were saying you do everything that you can to keep her alive. And Dr. Morheim was able to get the advanced directive. He walked into the room and he said, folks, she has already spoken through this advanced directive as to what her desire is, what she wants. And he said, all of a sudden, the room went silent. And everybody bonded over the fact that they were not making this decision now. She had made it. And they escorted him into her room. And the measures that were being utilized to keep her alive were terminated. And he said you could just see the relief that fell over all the family members because of this. And that's the goal. That's the intent and purpose of the legislation before you. And again, this is actually a consequence of the legislature reaching out to the council, and when they said, look, we know how important this is. You all focus on this. You've got the people who do it. Can you tell us how we get there? And that part of that, they did a great report that I believe every member of the committee has received, but part of it required this legislation that you have before you.
And if I can just add, I do believe that the system's part of what they'll do is they actually
We only
prompt
allow
more
one
than
person to respond,
apologies.
please. Delegate Carr.
Thank you.
Thank you, Mr. Chairman. Thank you, Senator Kramer. Thank you, Dr. Claiborne, for your testimony. Just having been through personally, as the end-of-life caregiver to my mom and my aunt not that long ago, I can really see the value of this bill. But now I'm just thinking about myself. I live in Montgomery County, but I work here in Anne Arundel County. And so if I have an advance directive with my hospital that's near my home, Suburban Hospital, but I have a heart attack here today in Anne Arundel County and I get sent to the medical center here, how would this bill benefit me in terms of making that advance directive available?
And thank you for that question, Delegate Carr, because that gets to the heart of what this legislation does. It will assure that the advance directives or encourage that the advance directives be loaded onto a common system that will be available whether something happens to you in Anne Arundel or if you're vacationing in Southern Maryland down in Lusby, and suddenly you're taken to a hospital, so that the attending physicians will be able to go to that central database and find out Delegate Al Carr's wishes and not have to start putting out feelers trying to, where's a family member? Okay, we got hold of this family member. You don't know anything? Who do you think in the family might? This son, this daughter, this brother, this sister. And so it facilitates the ability of the attending physicians to get right to that advance directive and know what Delegate Al Carr's wishes are as readily as possible.
Thank you, Senator. Delegate Riley, followed by Delegate Krebs, and then Delegate Johnson.
Thank you, Mr. Chairman, and thank you, Senator, for the bill. One question, isn't this, it sounds like it's similar to a living will? Because when I know, so like a living will, to where I know, my sister was in bad shape, so we went in and out of the hospital, and when we would go there, and then they would admit her, they would say, does she have a living will? And I would say yes, and we put it on file. Is this just something that is more permanent, but in the same concept?
Well, in the advance directive, yes, it's a very similar concept. I think Dr. Claiborne, if I may yield to Dr. Claiborne on that.
Sure, there's a lot of confusion
Certainly.
about these terms. The living will is actually speaking to the legal document where you identify a medical proxy. It doesn't necessarily in the living will detail some of the specifics of medical care that you might want in a situation like, I would not want to have, artificial nutrition or something like that. Whereas the advance directive gives you the opportunity to identify identify your medical proxy, which is the same as the living will, but it goes beyond that and includes some scope of specific medical interventions that you may or may not want. And so you can choose those and update those as you change with your health condition. And that's part of the reason why this should be a document, as is your living will, that's updated frequently. The living will is more something that people don't touch on as often because they usually choose one proxy and hopefully keep that person up to date. Whereas the advanced directive might change as your health changes or as something happens that changes your priorities. And so that's why it takes an additional step that's important in outlining, going beyond just who to talk to, but specifically informing that proxy what they should be doing, as well as the medical team directly.
Okay, and Mr. Chair, I have a follow-up question. Could I ask?
Let's move on. if we
Okay,
can.
all right, thank you.
Thank you. Delegate Krebs, followed by Delegate Johnson and Delegate Bhandari.
Thank you, Mr. Chair. And this is a new bill to this committee this year, and I thank the sponsor for bringing it to us because this committee cares a lot about this. But there's quite a bit of opposition, legitimate opposition, that Maryland Healthcare Commission, Maryland Hospital Association, not to the intention of the bill. I think we all agree with that, but it's just the mandatory one size sort of fits all. And I don't know, there's some issues in the Maryland Healthcare Commission report about just what we're doing today and how this could undermine some of the things that are already happening. So I guess the question to you is, how do we make sure that we're enhancing all the efforts that are being made today through the hospitals and through, we have AdVault, we also have some other ways that people are doing advanced directives. How do we make sure that this doesn't like throw the baby out with the bathwater and enhances and gives people choices of which products they want to be involved with?
Thank you for that, Delegate Krebs. I don't believe I have seen anything from the Maryland Healthcare Commission. As I noted in my introduction, I think, and quite frankly, well, I will say there was the Maryland Hospital Association, and as I indicated, I'm not sure that I quite understand what their concerns. There's nothing in here that limits anything they are doing or can do, but it will provide that the Maryland Healthcare Commission will coordinate with them to facilitate opportunities for advanced directives to be made available. And the same thing with the League of Health and Life Insurers. And the league indicated that they felt there was some kind of a limitation. I didn't understand that either, because any form will be able to be uploaded into the system. It doesn't limit anybody's opportunity to have the form they want. It's just the single commonality there will be this database that's been created, and it met all the standards that the state required for the system, and that is in place. And now let's best utilize it.
I would just suggest, I know time is short. I would suggest you look at the letter from the Maryland
We have to
Healthcare
move
Commission
on.
and look at some of their, Mr. Chairman, this is a new bill to us. It's a big deal.
I understand
think
that.
We should have our questions answered. So I suggest you take a look at the opposition and legitimately discuss what they are.
Thank you.
Thank you. Delegate Johnson.
Thank you, Mr. Chair, and thank you, Senator, for bringing us this bill. This would be a Maryland bill. So that would cover folks that if something happened to you here in Maryland. But did I hear someone say that there was a possibility this could be linked to CRISP? So no matter where you were, if something happened, an approved person having access to that system would be able to see this?
My understanding is that is correct, but I will yield to Dr. Claiborne, as she is far more intimately familiar with this. But yes, that's my understanding. Dr. Claiborne.
Yes, the system that's set up through AD Vault and My Directives is linked to CRISP. So for example, my father got COVID over Christmas. I was really nervous. He had to get admitted to the hospital. And so I wanted to make sure that they had all of his information. So I checked on the system. He had an advanced directive filled out through My Directives. It was pushed through CRISP. And so when the physician opened up their system, and CRISP is linked to a lot of electronic medical systems like Cerner and Epic automatically, that information was readily accessible accessible in the hospital. As soon as they opened my father's information, his advanced directive from AD Vault was right there and accessible in real time. It showed when it was signed. It had all the information. And that's an example of how it's linked in a system that's together with through AD Vault for our state of Maryland, but anyone that has access to CRISP, they are sending that information there so that it can be pulled easily through an EMR system that links to CRISP.
Thank you. That makes this an even better bill. Thank you, Mr. Chairman.
Delegate Bandari.
Thank you, Mr. Chair. Thank you, Senator. This is a wonderful bill. And there is opposition, as Senator Cripps touched upon it a little bit. Maryland Healthcare Commission, they write that using a web-based repository, that its availability exists outside of the clinical overflows, and based on their data, in 2020, just about 51 advanced directives in the web-based repository were accessed by provider. It seems to me that there should be an awareness language, why it is happening, because people don't know about it.
Yeah, I mean, part of the problem and part of the purpose of this bill and part of the reason that the legislature reached out to the council in the first place was so few people know, about advanced directives to begin with, but secondly, how to make them accessible. So if that was the question, I apologize if I misunderstood, but if that is the question, clearly, a big part of what this bill does and the report in its entirety, and again, this is a piece of it that requires legislative action, was all about facilitating both the knowledge and the access with regard to advanced directives. I hope I answered your question.
Yeah, you did. If Mr. Chair, if I can. Yeah.
Well, I will say this. Chair Pendergrass wanted to ask a question, has stepped away momentarily. So I'm going to use the prerogative of the chair to go back to Delegate Riley.
Okay.
The first individual who wanted to ask a second question. I'm not saying everybody's going to get a second question, but I want to continue the hearing so that if Chairman Pendergrass desires and gets back, she can ask her question. Delegate Riley.
Thank you, Mr. Chair. Yeah, I was just wondering, in the bill, does this make this mandatory that someone would have to fill out the advanced directory through the MVA or what have you, whatever they come up with, or is it still optional?
No, this is nothing more than we want to let you know the advanced directives exist. Here's the merit, and that's as far as it goes at any point through the legislation. It's
so just educating them that this is the, okay.
Just
Great.
about
Thank you.
education and making it accessible.
Thank you, Senator and Mr. Chair.
Thank you.
Thank you. Delegate Krebs, brief question? Or no? Okay.
No, I just wanted to make sure that the bill sponsor had looked at the opposition testimony. He said he didn't see it. And I think our committee likes to make sure that we consider everything. And there's some very points in there that I think we got to make sure that there's opportunities for them to have some input on this. I mean, we're all on the same page, but I think the three opposition votes have something to be said for them that we might be able to include in this bill to make it everybody happy. One of the issues that they had was the more people would rather do it through their hospital through electronic health record versus doing it on a web-based, and there was some study that was done. And those are issues we got to, if you go everything web-based, people would not prefer that. So we want to make sure there's options for people and they're not just guided.
Okay, thank you.
And if I may quickly respond, Delegate Krebs will remain in place. This bill does nothing to change that. And I do, that I do want to be clear on. This legislation does not change that at all. So anyone who wants to follow that procedure, God bless.
Okay, new additional hands, Delegate Young, and then Delegate Belcastro.
Thank you very much, Mr. Chair. I remember when my mother's physician insisted she do an advanced direction. And then later I saw a bill for $100 for 5 minutes worth of questioning that I could have handled myself. So my question is, do you think that part of this opposition might be stemmed in competition or fee income opportunities?
Well, that's a very good question. If the hospitals are somehow, utilizing this as a profit center, then perhaps that is motivation for their, not looking at it favorably. But I don't know whether there will be folks testifying, and you may ask that question of them if they're here today. But that's a very good point that you just made.
Thank you.
Delegate Belcastro.
Thank you, Mr. Chair. My question's for Dr. Claiborne. It was mentioned in the hearing that there's disparities among people that have advanced care directives, particularly those that are Black. I was wondering if you can elaborate on how this bill could address that.
Thanks for bringing that up. As an African-American provider and physician myself who cares for a predominantly African-American population, I really see why this is an issue. These conversations about end-of-life care, advanced directives are very sensitive, right? They're culturally, religiously, personally sensitive. And so it is a touchy subject that you sometimes, do not get great traction with if you have a minority population that is distrusting of the healthcare system to begin with. And what I think this bill does is it gives them an outlet to have their own voice and be able to say in whatever setting they want, in collaboration with someone like me, if they're comfortable, or just using the platform by themselves, or using a primary care doctor who they, trust, to go through those questions and make sure that they're actually getting their voice heard, and that they're not going to be overridden by like a doctor pressuring them in an emergent situation, do this or don't do that. So I think it empowers people, allows them to have confidence that their wishes are going to be respected, and then have, the understanding that, that information will be available to everyone widely, and that it will be respected and it can be changed, but it's secure and representative of what's important to them. And I think that's important messaging for our minority communities that have a lot of distrust when it comes to the care that they want to receive and that they feel that they're deserving as they are in a healthcare system, especially with sensitive issues like this. So I get a lot of buy-in with these communities just because they see me and they think that I'm on their side. And so it is helpful to have someone lead them through that process. But some people, they just want to make sure, look, this is what's important to me. I want to make sure I get that down and document it so everyone can understand what my voice is and what my concerns are, and that they're respected.
Thank you very much for that. I appreciate it.
Vice Chair Pena-Melnick.
Thank you, Mr. Chairman, and good afternoon, Senator. I guess just going into the question, following the question by Delegate Krebs regarding the Maryland Healthcare Commission letter, one of the things that they say is that their opposition is based on the fact that your bill promotes a single standalone advanced directive repository that has not been accepted by consumers. So I guess my question is this for one company only? Can you expand and elaborate on this, please?
My understanding is that there is only one computer system has been developed and built to the state's specifications to serve this purpose. And that was a consequence of legislation that had passed previously, requiring that the system be put out to bid. It was. A company was chosen to develop the system, and it is required to meet all of the standards that the state put in place, including security standards. And that is the database that is referenced in the bill, because there is no other, as far as I understand, and again, Dr. Claiborne might want to qualify this, but there is only this one system, and that's why it references this system, because it's the only one that was purposely developed by the state to do this.
And if I'm asking you the question,
no.
Excuse me.
We've limited other people to one question.
Okay, it wasn't a question, it was a clarification, but that's okay.
Okay. We're going to proceed now to the witnesses in opposition, but I would ask if the chair returns and wishes to still ask a question, the sponsor or the Dr. Claiborne, I will allow that.
Delegate Rosenberg, if I may quickly, we're going to be starting a voting session in committee very shortly. If this spills into that time and I find out we've got something that they really need me for, I hope you'll be understanding.
Certainly, and we appreciate Dr. Claiborne being here as well. Thank you. Matt Celentano, please.
Thank you, Mr. Chair. Members of the committee, my name is Matt Celentano, here today on behalf of the League of Life and Health Insurers of Maryland, including Aetna, Care First, Cigna, Kaiser Permanente, and United Healthcare, respectfully opposed to Senate Bill 837. First and foremost, carriers are not opposed to the advancement in education around advanced directives. We think these discussions are critically important for families as well as the healthcare system. Once again, we are not opposed to the advancement of advanced directives. The League believes this communication and decision is best had between a patient and a healthcare provider, and in fact is the current practice in hospitals in Maryland. In addition, Maryland already has a law that requires carriers to provide members with notice about advanced directives. So we do it already. But we should enhance the existing advanced directive notice requirements instead of directing consumers to only one course of action, one repository, as written in Senate Bill 837. You should have a letter from me, which we included amendments to add in the advanced directive information sheet, a link to the list of electronic advanced directive services as approved by the Maryland Healthcare Commission. Another challenge in the bill for carriers is that we don't do the enrollment for on-exchange individual members, or do we do it for group enrollments? That's done through brokers. We would be missing a significant portion of the population as the bill is drafted. Finally, we're very concerned that the bill limits consumer choice and directs them to one web-based repository. Once again, carriers are not opposed to the different approaches to getting advanced directives completed, but this mandates carriers to only filter Marylanders to one place, and a place that has not been utilized by Marylanders. Last year, only Maryland Healthcare Commission approved the only third-party vendor. 50 times did providers access Marylanders' advanced directives. 50 times. This infrequency is alarming, and we can surely do better. We should be providing Marylanders with multiple avenues to complete their advanced directives in ways in which they are comfortable. We're totally committed to sitting down at the table with all the stakeholders, the Horizon Foundation, one of the proponents, the Healthcare Commission, MHA, BedChi, during the interim to come up with a better solution than Senate Bill 837, and we request an unfavorable report. Thank you.
Thank you. Questions first from Delegate Young and Delegate Pena-Melnick. You're out. Delegate Young.
Thank you very much. I have a question. If you support this in concept and you're willing to sit down and work it out with all the parties, why isn't your position favorable with amendment as opposed to unfavorable?
Well, as the bill was written and with the limited time, we are opposed to the bill as drafted. But Delegate Young, we would be happy to figure out a way forward. And that's why I did include amendments. If you guys decide to move forward with this bill, there are other avenues. But like I said, carriers are already required to send out notices about different avenues. The problem with this bill is that it only steers folks to one place. And that place is not being utilized by the providers. So it's sort of against the intent of the bill. We're not getting providers to access the advanced directives with the current scheme that's set up in this bill.
Thank you.
Delegate Pena-Melnick has taken her hand down. The chair seeing no further questions. This concludes the hearing on that bill. Thank you very much, Senator. Appreciate your coming to see us.
Thank you, Mr. Chair. Thanks, committee. Everybody stay healthy.
The next bill is Senate Bill 649. Is Senator Griffith with us?
My understanding is that Senator Griffith's aide is going to be presenting on her behalf, and she is joining the hearing right now.
Is he connecting to audio? Ms. Sproul? Cameron Sproul, are you here to testify for Senator Griffith? You need to unmute yourself, I believe. Cameron Sproul, Ms. Sproul.
Yes, I can hear you now. I was having
Fine.
an issue. Good afternoon, Chair Pendergrass, Vice Chair Pena-Melnick, and members of the Health and Government Operations Committee. My name is Cameron Sproul. I'm Senator Griffith's legislative aide, and I'll be presenting on her behalf today. We're requesting a favorable report for Senate Bill 649 MBE MBE program compliance review and oversight. Senate Bill 649 is based on the work done by the Senate President's work group on equity and inclusion, and it received a unanimous favorable vote from the Senate. Now, this bill strengthens GOSBA's authority in implementing the state's minority business enterprise program goals. The key provisions of the bill are GOSBA's review of draft MBE goals and sub-goals on high-value contracts, additional reporting requirements, small procurement requirements to make good faith on efforts to solicit at least one bid from certified MBEs, and requires prospective contractors to attend pre-bid or pre-proposal meetings, and requires DLS to conduct a review of statutory and regulatory requirements of the MBE program. Now, Senate Bill 649 will ensure that there's a proactive accountability to help Maryland meet its 29% of total dollar value of procurement contracts. We also offer technical and clarifying amendments that were uploaded with testimony today.
Okay. Are there any questions for Ms. Sproul? Delegate Johnson.
Thank you, Mr. Chairman. Are you aware of the Maryland Department of General Services, their opposition saying this bill duplicates the efforts of the Governor's Office of Small Minority and Women Business and seems to duplicate the reporting of units MBEs?
So there has been additional units to report for GOSBA, and it's new units, or rather clarified or adding to those. So, but I'll be happy to have Senator Griffith send over more details, or our office send over more clarification about that.
If he could do that, that would be helpful. Thank you. Thank you, Mr. Chairman.
Thank you, Delegate. Are there any further questions for Ms. Sproul on Senate Bill 649? She is the only witness. Seeing no questions, that concludes the hearing. Thank you, Ms. Sproul.
Thank you. You're a wonderful one.
Pleasure. Senate Bill 721 is the next bill. Senator Hester, Small Procurement, Small Business Reserve Program, Administration and Application.
We're still waiting for the senator to join us. I called her office, so she should be here momentarily.
Okay. Well, she has the next two bills. But her office indicated she'll be with us momentarily.
Yes, that's what they told me. Here she is.
Okay. Senator Hester? Well, you're not there yet.
She's in now.
Senator Hester, we can't see you. Now we can. We can't hear you. Welcome, Senator Hester. We're going to take your Senate Bill 721 first. Is that, I hope you're prepared to do that one first. That's our order, if we will. So Senate Bill.
That would be fine. Let me just pull it up.
Okay. And then Senate Bill 69. Senate Bill 721 is Procurement, Small Business Reserve Program, Administration and Application. When you're ready, Senator Hester.
Thank you very much, Delegate Rosenberg. And thank you to the esteemed members of the committee for your consideration of Senate Bill 721. As you probably know, right after the new year, Governor Hogan issued an executive order to increase small business participation in state procurement by designating all state procurements between 50 and 500,000 for the Small Business Reserve Program, with a few exceptions. And of course, this was a welcome move for our small business community and good for Maryland's economy. Senate Bill 727 builds on the governor's executive order by codifying that all state agencies purchase of goods and services under $500,000 should be designated for the SBR program, unless the agencies seek and receive exemptions for certain contracts from the coordinating office, and that's the Governor's Office of Small, Minority, and Women Business Affairs. In addition, the bill also requires public universities in Maryland, which are currently exempt from most SBR provisions, to be subject to the same requirements as state agencies. Beyond that, this bill also requires the Governor's Office of Small Businesses to develop guidelines for participating agencies and to assist small businesses in procedures for responding to state RFPs to promote awareness of procurement opportunities to those businesses that are new to government contracting. So essentially, this bill codifies and enhances the governor's executive order to make sure that when it comes to government contracting, the default is to start with our Small Business Reserve Program, not the exceptions. We can all agree that there's simply no better time to help our struggling small businesses in whatever way we can, and this is a relatively easier way to help them while also contributing to our local economy. I respectfully request a favorable report on Senate Bill 771.
Are there any questions for the senator? Yes, Delegate Johnson, followed by Delegate Hill.
Thank you, Mr. Chairman, and thank you for bringing us this bill. I was looking at the opposition letters from the Maryland Asphalt Association and the Maryland Transportation Builders and Materials Association, where it says Senate Bill 721 puts a significant disadvantage on our industry and by prioritizing other establishments. Can you go over that a little bit with us, please?
Thank you for the question, Delegate Johnson. I believe that the bill does seek to help small businesses through state contracting. They're not as good currently as the big businesses, particularly those that are, under a certain number of employees or brand new to government contracting. So I'm happy I don't think they offered an amendment. I think they're just worried about, being somehow cut out, but I would just counter that. I think that we're already doing quite a lot of contracting with them. So the point of the bill is really to help the small businesses through the SBA program.
All right, thank you. Thank you, Mr. Chairman.
Thank you. Delegate Hill, followed by Delegate Krebs.
Good afternoon, Senator Hester, and thank you for this bill. Could you just help me to understand how this would work with the other preference groups, the blind industries, the Maryland Corrections Enterprises, other groups that universities and state institutions are told to procure preferentially from? How would that work?
Thank you very much for the question, Delegate Hill. So the Small Business Reserve and the MBE and the programs that you mentioned, they are all currently working simultaneously. And I think I'd have to get back to you because I don't want to give you a wrong answer on that question. But the answer is they do work together. And let me just circle back to the committee with that answer.
Thank you.
Thank you.
Delegate Krebs.
Sorry about that. Thank you. I mean, should my question been answered, but I'm still trying to figure out if you could give me an example, how this would impact our current providers and how do we ensure, I noticed on page 5, it is, provide for the efficient exemption of procurements from the Small Business Reserve Program, including certain term and master contracts. So how would this bill affect people with these master contracts and term contracts? And give me an example of how this, see this working for someone. Use the asphalt industry for road. Use roads as an example.
Okay, thank you very much, Delegate Krebs. It's great to see you. So let me just remind you that currently this is codifying the governor's executive order. So this is current, not law, but it's currently happening. In terms of an example, I'm more familiar with food procurement because I spent 2 years working with DGS and the Department of Agriculture on the certified local farmer program. And in that program, there's a lot of big purchases that go out. So you might be buying a whole bunch of apples at the same time. And so the unbundling of those contracts to allow for smaller businesses to provide their apples is a very, very high level example. I would be happy to get back to you also with a specific example for the asphalt industry.
Thank you. Just because they have I think they have a lot of equipment and all that they need. I just like to specifically understand how it would affect them since they have a concern about it, but I appreciate that.
Yeah, I'll actually I'll give them a call because they probably know their industry best.
Thank you.
If I may, Senator Hester, does this bill go beyond in any way the executive order, or is it pure and simple a codification of the executive order?
Yes, so it does go slightly beyond it. The governor's executive order stated that procurements between $50,000 and $500,000 were allocated for the Small Business Reserve Program. So I couldn't find a good reason to cut out the $50,000 and below. So we just said that everything below $500,000 without that lower cap, a lower level of the 50,000. So that's one difference. I mean, the other difference is the technical assistance that this bill provides. So it offers guidelines for the agencies and how to, help the participating agencies work with the small business program. And then it also provides technical assistance to the small businesses and how they should respond to the RFPs. The governor's office also exempted all of the public universities in Maryland. And this bill pulled those underneath as well, thinking that we should all be working in terms of our purchasing to help to buy from small businesses where possible.
Thank you. There being no further questions, that concludes the hearing on that bill. We'll turn to Senate Bill 69, also Senator Hester, Cybersecurity Coordination and Operations, Establishment and Reporting. Senator Hester.
Thank you very much, Delegate Rosenberg. So I'm seeing now you all are pulling up my slide. This is wonderful. I was in another meeting earlier today where I wasn't allowed to use it, and it caught me a little off guard, but that's fine. So just get my notes side by side with your presentation. So if you guys could go beyond the title slide to the next slide. Okay, so basically, as we're all aware, the cybersecurity attacks are increasing. In 2019, we saw Baltimore City as a victim. In 2019, the Salisbury Police Department was attacked. And in 2020, the Baltimore Public Schools were attacked, and many of our residents in the Baltimore County area, their kids were not only home because of COVID-19, but also because of the cybersecurity attack. We found this great map online, which I hopefully is showing on your screen, which just shows how these attacks are growing over the entire state. Next slide, please. Okay, so the bottom line, as chair of the Joint Committee on Cyber IT and Biotechnology, my co-chair was now Senator Jackson, but many of you will remember him as Delegate Jackson. We chaired it together, and now it's Delegate Young. We are convinced that we are unfortunately underprepared for cybersecurity attacks. The first letter on your left-hand side, is a letter from the Attorney General, which states that in 2017 that we were underfunding cybersecurity by about $20 million. And we haven't invested $20 million since 2017. So I believe that we are still underinvesting in cybersecurity. The second thing on this slide is the Department of Legislative Service Office of Legislative Audits, their findings on personally identifiable information. They found that between 2014, 2019, of the 457 audits they did, there were 84 findings of lack of adequate controls over this personally identifiable information, such as your social security numbers, your credit cards, all that kind of stuff. And that could cost the state $37.9 million. The last piece of information Sorry, can't see it. I'll have to get back to you on that one. So let's go to the next slide and let me just tell you what Senate Bill 69 does. So first of all, there's 4 parts to this bill. It creates the state structure for cybersecurity governance, which is once again codifying the governor's current executive order and expanding it slightly. Second, it provides technical assistance to localities because they are some of the groups that are getting hardest hit, the school systems, the local governments, and as we saw, the police department. And third, it offers periodic reports and cybersecurity assessments. And fourth, puts into place protocols for incident response and preparedness. So just moving on to the next slide, just to break it down. So this was the executive order from 2019, which created the state CISO in the Department of IT and the Office of Security Management. So this bill codifies those 2 things. Moving on to the next slide, the technical assistance. Within this office, this bill goes beyond the executive order by creating the Director of Local Cybersecurity Preparedness. So this part of the office will provide technical assistance to localities. It will help to coordinate resources. It will work with the Maryland Emergency Management Agency to develop cybersecurity preparedness and response plans, the same as they do for other issues like flooding. And then finally, it will look at the completed reports for the improvement of local cybersecurity preparedness at the local level. Next slide, please. So the third thing is that it requires these annual assessments and reports. And I think this is super important because we all share the common ISP, Network Maryland. And by doing these assessments and reports, we can know that we're all basically implementing the best practices that we have and addressing the cybersecurity vulnerabilities across the state. This is something that the state started doing 2 years ago, and we've made it through, some of our state agencies, but all of them. And this would expand that using some of the free federal resources available to the local level. Next slide, please. And so forth. In the Senate, we took all four or five of the cybersecurity bills that we had and had a work group on them. And when we talked to the local IT folks that MML and MACO put forward, they weren't sure how to deal with a cybersecurity attack. They guessed maybe it was their local emergency management person. Somebody else said maybe we could all do it. So I think it's super important that we actually define how we report our cybersecurity incidents. And at the state level, those go to the state chief information officer in this bill. At the local level, it goes to our local emergency manager. And so and as I mentioned earlier, local governments are also required to update their cybersecurity preparedness assessment and submit that to the Office of Security Management. Next slide, please. So finally, I actually was on the phone earlier this morning talking with, DeWitt about the fiscal note. I don't believe the fiscal note is right. You probably hear that a lot, but I can tell you why. But I do like to think about this as a smart investment in cybersecurity. There are a number of free resources right now. And so the expenses that you see in the fiscal report that are aimed at both the local and the state level, there are numerous grants that agencies and localities can apply for to get those for free. In addition, there's also available through the federal state Homeland Security, and DHS actually recently increased the amount of funding we're required to spend on cybersecurity from 5 to 7.5%. We also have numerous resources here in the state of Maryland, including the University of Maryland Center for Health and Homeland Security, and they were able to testify on the Senate side and had really great points. You have a chance to listen to that. Let's see. When we talked to DeWitt this morning about the fiscal note, they agreed with us that a lot of the costs with the assessments could be covered by these existing grants. And they also said that because of the way we consolidated a couple of the bills in the House, the 16 pins weren't necessary, that they probably would need, 5 or 6. And I think that's a reasonable investment considering the fact that we're facing all of these attacks. And so I'd be happy to get back to you guys with more information or a follow-up letter from Do It on that. Last slide, please. I just wanted to quickly summarize why you should vote for this bill. The American Rescue Plan includes $650 million appropriated to CISA to mitigate these cybersecurity risks. They've actually established at the federal level a state director of local cybersecurity, which would work with each of the states. So in effect, we're kind of mirroring what's happening at the federal level. We've all seen how our local government, school systems, and health departments are exposed. And finally, the potential loss of revenue, the damage that can be created from economics, but also to our constituents if their personally identifiable information is leaked or sold, is, the investment in this bill far outweighs the investments in the potential risk of cybersecurity to the state of Maryland. And so with that, I just ask for your favorable report, and I'd be happy to answer any questions you might have.
Okay, thank you very much, Senator. We have one witness in support, and then we'll take questions. Robert Day. You have 2 minutes, Mr. Day.
All right. Well, Mr. Chair and Vice Chair, members of the committee, and thank you for the opportunity to testify in favor of SB 69. My name is Robert Day. I'm a council member in the city of College Park, a member of the Maryland Cybersecurity Council, and a senior management officer with the technology development firm White Brook Technologies out of Columbia, Maryland. I've been in the information technology and network security field for over 30 years. I don't want to repeat a lot of what was said before, but I'll just say this. While various structures have been established and developed to deal with the cybersecurity throughout the state of Maryland, many are still at their early stages and are not fully developed. By establishing a cybersecurity coordination office with the charge of developing a compliance baseline and reporting structure with yearly review, will strengthen the cybersecurity ecosystem across the state. A top-down approach to cybersecurity governance and operations will help to identify any weak links in the chain and create an efficient and quick response to events as they happen. Based on my experience working within the IT infrastructure and network cybersecurity fields, I strongly support SB 69, establishing an enterprise-wide cybersecurity governance function with a statewide holistic approach to cybersecurity with partners between the government, businesses, and cybersecurity communities to achieve this goal. I believe the objectives in this bill in establishing this office will help to address the strong complexities of best practices up and down the security stack while maintaining a strong cybersecurity ecosystem throughout entities in our state. To the members of this committee, I'd like to thank you for your time and the opportunity to give testimony here today. I encourage a favorable report of SB 69 and thank you for your consideration.
Thank you very much, Mr. Day. Let's begin with Delegate Chisholm, followed by Delegate Charles.
Thank you, Mr. Chair, and thank you for bringing this bill, Senator Hester. When government officials say we need to invest, it usually scares me, but for once, I agree with you. I think this is vitally important. And yesterday we heard SB 351, which was a program to do it. And it sounds like you guys have been working in a work group with everybody. Was that brought into consideration? And does this bill create a better approach and basically take SB 351 and render it useless? Because you guys are actually, if I understand the bill correctly, you're answering just about everything that they wanted, but in a way that gives greater flexibility to the local and also brings in some private-public partnerships. Am I correct on that?
Thank you, Delegate. Yes, you are correct. I couldn't have said it better myself. We did look at 5 bills in the Senate. We spent about 3 weeks on it. And the bill that you mentioned, 351, specifically addresses the standards and the definition of different types of data and how they are stored for personally identifiable information. So it's kind of that is part of the package that's specifically focused on PII. There was another bill, Senate Bill 49, which you may have heard, which talked about the overall strategy and how the strategy for cybersecurity for the state is formed. This bill, Senate Bill 69, is really about getting the work done. So this is about how we provide the resources to get it done. It's about the office and the structure, and then it's about the accountability. And so this is the kind of the management functional piece of the package. The fourth bill, the package, is a training requirement bill, because oftentimes in cybersecurity, us as humans, we're the weakest link. And so that bill is the fourth piece. And the fifth bill dealt with reporting, and that actually got wrapped into this bill, Senate Bill 69. So there's currently only 4 bills in the package. And I have a 2-pager on the package, which if you haven't received, I can send around immediately after this call.
That would be excellent. Thank you, Senator Hester. Thank you.
Thank you for your support.
Thank you. Delegate Charles, followed by Delegate Krebs.
Thank you, Mr. Chair, and thank you, Senator Hester, for bringing this bill. Listening to you, it made me think back to my time at Naval Sea Systems Command, where we're dealing with cyber attacks from China. And so having something like this in place is very critical. Now, how do you plan to deal with the infrastructure issues as far as making sure we're protecting PEPCO, our energy, PEPCO, BG&E, the internet, the cell phone? How does that cross-pollinate with the local agencies, bringing in some of the corporate entities that can be impacted and literally cripple the entire state if a cyber attack came after any of those entities as well?
Thank you for the question, Delegate, and thank you for your service. Question, and the Maryland Cybersecurity Council, chaired by the Attorney General, has a specific subcommittee that deals with critical infrastructure, and I believe the entities that you discussed are part of that. This bill does not yet address that. I mean, it's a huge addition to the state to support our locals. And so I would have to get back to you on what we currently have in place to support the critical infrastructure, because that is handled by a separate subcommittee. So I'll get back to you on that. Great question.
Okay.
Delegate Krebs, followed by Delegate Pena-Melnick.
Thank you, Senator Hester. You obviously have done a great deal of work on this, and Delegate Watson, I believe, was the House cross-file. But I'm trying to understand how this all goes together with what we already are doing. We established the Office of Security Management within DO-IT back, I guess, through Executive Order 19, and then we passed legislation in this committee, I guess, last year for another piece of it. There's all these pieces, and some is MEMA and some is DO-IT. So how does this coordinate with what's already in place and in these little pieces that we've already done? And then who,
Hey,
MEMA or is it
ask,
DO-IT?
ask this question for me in there?
Sure, good. So I'm trying to just figure out what with what's already in place and what is going on here, how does the structure change with MEMA versus DO-IT? Because the fiscal is to MEMA, and then DO-IT says they advise they can coordinate and consult and using existing resources. So I'm trying to figure out who's going to be doing what, who's responsible.
That is another great question, Delegate Krebs. That is why we have the work group. So the office and the CISO currently exists. They in the executive order. This codifies that.
Okay.
Expands it. The bill that you mentioned from last year was the bill that offered the local support through Maryland Emergency Management Agency. That might have passed the House, I mean, that passed the Senate, but it didn't pass the House, so it was never enacted. Currently, MEMA, through their existing local folks in each of the counties, they offer preparedness support for many things. And in some counties, that also extends to cybersecurity. But what this bill does is it builds out that office that already exists. It adds a second director of local cybersecurity preparedness. In order to be efficient with our state resources, that local director then works with the Maryland Emergency Management Agency to use the existing folks in the county to help roll out the DO-IT policy, the DO-IT guidelines, it uses the existing MEMA folks to help with these cybersecurity preparedness and response plans like they do for other issues. But then it rolls it back up so that they're reviewed by the Office of Information Technology within DO-IT. So it's a collaboration between the two agencies, which I think is an efficient use of resources. And the other thing I'll just mention is, as Delegate Chisholm said, DO-IT also works with other folks like our universities, our private sector SWAT teams, the National Guard, to pull all these different pieces together. So they coordinate things either in preparation, like tabletop exercises, or in response in case there's a thing on the ground. So
Do those two departments, do they both support the money? Do they support the bill? Do you know?
both of them do. They're both part of our 4-week working group.
Okay, that's helpful. Thank you.
Thank you. Delegate Pena-Melnick.
Good afternoon, Senator.
Good afternoon.
Yeah, my question is, has the Attorney General given you advice on these, separation of power issues raised in this bill?
We haven't sought a professional Attorney General opinion on that. I would be happy to, but the Attorney General did weigh in support of several of these bills. So in general, he is supportive. He thinks that we're not protecting the state enough. That's why he wrote the letter to the governor several years ago. And I think the separation of powers issues where you're looking at the State Board of Elections or the judicial area, they're currently carved out from DO-IT oversight, and this bill does not seek to give DO-IT oversight. It just asks them, in certain places to share what they're doing. So I'd be happy to seek a professional opinion if you think that would help.
That would be great. Thank you so much. And if you can share it with the committee.
Of course.
Thank you.
Great question.
Thank you.
Delegate Morgan.
Thank you, Mr. Chairman. We had a side conversation where we were talking about red flag, where the military bases or units in the military actually study this. I think Delegate Charles could probably articulate our concern a little bit better. I'll yield my time to him. Delegate Charles.
Thanks, Delegate Morgan. So I just wanted to kind of get a little bit more detail about that tabletop discussion you were having prior to, like the Air Force. We bring a lot of our allies together so we can see, how we utilize all of our systems together, how we truly can protect our country when everyone comes together and under one particular action. How are we doing that with the assessment process under this bill? Will that help bring everybody together, like you said, the state troopers, the all of the infrastructure folks that I mentioned earlier, all of the local governments, so we can kind of see scenarios and then see where a lot of the inefficiencies are, so we can fix that and then come back and put more money into this particular program or this office, so we can truly protect Maryland?
Another great question. So the tabletop exercise, as I mentioned, it's one of the coordinating roles of MEMA. They do these exercises for preparedness, but it's not mandated anywhere. I don't know how many there were last year, but it's really Director Strickland is passionate about this, and I would leave that up to the will of the committee if you felt like you wanted to add that to the bill. But it's currently something that's done ad hoc. But I think having this stronger relationship, between state and local and between DO-IT and MEMA and the extra staff that will be involved will make things like that more systematic and thus the state safer.
Okay, thank you, Delegate. I have a question. You mentioned the federal money that is available under the American Rescue Plan. Is the executive branch submitting a request for any of that money? Because you said there is an unmet need, I believe. You said $2 million from your testimony or more.
So the letter from the Attorney General back in 2017 was over $20 million gap.
Sorry. Yeah.
And, a lot of our updating, we all heard about the Department of Labor and them updating the beacon system. Like that is an example of a legacy update project that was matched by the government 90% to 10%. And whenever you update your legacy stuff, you do all the cybersecurity stuff at the same time. So it's currently happening in a piecemeal agency by agency approach. One of the roles of the Department of IT, and particularly the local side, is to help go after these grants. So, I think that the state CISO and the Secretary of DO-IT, they are aware of these grants. I'm not sure how much they're going after. I mean, we should definitely follow up with them. But it's actually part of the bill that the office will help the locals secure these resources.
Thank you. There being no further questions, this concludes the hearing. Thank you very much, Senator Hester.
Thank you so much.
Our final bill for today is Senate Bill 735. Senator West, State Government Notarial Arts Remote Notarization. Senator West.
Thank you.
Senate Bill 735.
Yes.
Welcome back.
Adjust my computer. It seems like every time I testify for HGO, I have a different moderator, so it's sort of fun. Nice to see you, Delegate Rosenberg, and as well as my other friends. So this bill, I'm not sure how much time you want me to spend on this bill. This is a cross-file of House Bill 1265, which Delegate Fisher presented, I think, about 2 weeks ago. Am I right on that? The March 17th. This bill, the Senate version of this bill, passed on the floor of the Senate 45-0. I'll just briefly describe it. It's I think a very important bill. After COVID hit, the governor issued executive orders authorizing notarizations to be applied remotely because nobody wanted to have a stranger, a notary, in their presence as they signed documents, given the COVID problem. So this governor's executive order permits the notarizations to be applied remotely. This is not unusual. We passed a bill a couple of years ago allowing that to happen, but wills and trusts were exempted from that or not included in that at the request of the State Bar Association's Estates and Trust section. They never thought there would be such a thing as COVID. So all of a sudden last spring, they realized they got a big problem because to the extent these wills and estate documents need to be notarized, the only way to do it was to have the notary in person. So they worked with the governor's legal counsel. The governor issued an executive order authorizing notarizations to be applied remotely. Pursuant to that, lots of documents have been indeed notarized remotely. The one problem we've got, though, is down the road when the pandemic ends and the governor's emergency declaration is rescinded, simultaneously, all the executive orders issued under the emergency declaration authority will also disappear evanesce instantaneously. And that means you're going to have a lot of documents out there which were notarized remotely, even though Maryland's underlying law in this case did not permit them to be notarized remotely. So one important thing this does is to apply this bill retroactively to March 30th, 2020, so that all the documents that were notarized remotely in accordance with the executive order are retrospectively validated, as it were. This also has a small reason why it goes forward. There currently are 3 ways in which a document can be, in which a notary public can make sure that the person whose signature they are notarizing indeed is the right person. There was some question as to whether the third of the 3 would have to be used, which is very complicated. It's credential analysis and identity proofing. This just makes it clear that you can use either one of the first 2 methods and not have to use the third method, which is much more complicated and frankly expensive. So that's what it is. We passed it 47-0 on the floor of the Senate, and I sure hope that, 45-0. I sure hope that the House Government Operations Committee, Health and Government Operations Committee, will see that this is a valuable bill and will move it forward favorably. Thank you. I'll be happy to take questions.
We have another witness, and then you will be available. Thank you for questions. William O'Connell from the MS Real Property section.
Thank you for having me. What Senator West said is
is true. The code presently allows for a paper version of the document to be remotely signed. This is spelling it out so you don't have to be a professional in reading the code to understand it. The other thing it does is it well, that's the clarification part of it. Now there was an amendment that I don't know if it made it in that allows for the Secretary of State to increase the allowable charge for a remote notarization under Government Code Section 18107. Now, if that's in the amendments, then that's great. If it's not in there, then it should be, because part of the problem that we have right now is that the allowable charge for a remote online notarization is set at $4. Nobody can do it for that. You have to lose money every time you do it. And what that means is people have to use online notaries from other states where they don't have that $4 restriction. And because the computer knows no state boundary, you can be anywhere. And if you're going to use notaries from other states, that kind of defeats the purpose of allowing the Secretary of State to regulate notaries and make the notary subject to our laws. So we really need to allow for the increase in the charge. It's set up so that the Secretary of State can set the fee after, doing their due diligence and figuring out what is an appropriate amount. And so I'm out of time, but I'm happy to take questions if you have any.
Thank you. Are there questions for the sponsor or for Mr. O'Connell? Delegate Hill, followed by Delegate Krebs.
Thank you. Thank you, Senator. And always good to see you. The issue of the fees, I think we saw that on some notary bills we did last year too. Was that something that you took a position on, having secretary rather than having a set fee in the bill? You've worked this bill pretty hard. So what's your position?
So,
and why,
okay, so what happened? Yeah, so what happened was.
I'm asking Senator West.
Oh, I'm sorry.
Senator West.
It's never been in, but I'm sorry, I won't talk.
We worked carefully or extensively with Mr. O'Connell, as well as a representative of the Estates and Trust section in the work up to the Senate hearing on this bill. And initially, I think Mr. O'Connell will agree that the real property section, which he represents, was opposed to the bill. But then I said, look, we can't have two different sections of the State Bar Association taking different positions on this bill, since this is the bill of the Estates and Trust section. So Mr. O'Connell worked with the Estates and Trust section intensively over the course of a long weekend and came up with language that they both agreed on. I believe we adopted that language as an amendment on the Senate side. It should be in the bill as it reaches you today.
Okay.
I believe you have before you a consensus bill.
All right, thank you.
Thank you. Delegate Krebs, followed by Delegate Johnson.
Thank you. And I apologize. I don't have a copy of the Senate bill in front of me, but I have the House bill and the amendments that were offered. And then we did not vote on the House bill. So can you tell me what ended up in the Senate bill with regard to the fees? Is it left to the state, or is it, because we had a number of $25 and $50 that was being requested in the amendment on the House side. So how is it left on the Senate bill?
Thank you, Delegate Krebs. I prefer to defer to Mr. O'Connell on this.
That's it. You got it.
I did backwards and forwards, and once they came with consensus,
okay, Mr. O'Connell.
Let's go with it.
I'm so
Mr.
sorry.
O'Connell.
It's the same. I
It's-
just
what do you mean?
couldn't. I couldn't
It's the
see it
same, so
online.
This is the adopted. So you adopted with the $25 and the $50.
Yes.
I'm just a follow-up question. It's going up from $4 to $25. That's 600%, and from $4 to $50, that's that's a lot. It's 10 times the amount, 11 times the amount. So how did you come up with those numbers? That's a huge increase, and
yes,
I think that was a holdup that we had going up that much.
the idea was it's not going to be 25 and it won't be 50. It's set so that those are maximum dollars that the Secretary of State will determine what's an appropriate fee. And the idea is so that that you don't have to come back to the legislature every time it's determined that the fee should go up. So the idea was the Secretary of State will canvass the country, see what others charge, see what's a reasonable fee. The goal here is not to get notaries rich off of this stuff. It's really just to allow them to recover what it costs them to do it. So the number was set so that they could determine and then not have to keep coming back to the legislature.
Gotcha. But that is our job, and we are very willing to do that.
Yes.
Thank you. Delegate Johnson.
Thank you, Mr. Chairman. And whoever's best to answer this question. Last year, we did look at this, and the reason we came up with $4 was to make it consistent with in-person notaries. So people, if they needed to use the remote, would use the remote. So now we're making it way more expensive to use the remote. So do you think that will cause people not to use the remote notaries? And the fees that you're looking at, are they in any way going to affect the in-person notaries?
No. This is a tool that will allow people to get their documents notarized. Some people would prefer to do it all in person. Others would prefer to use the computer. And so the reason why the fee is right now is at $4 is because when we were trying to get Rolona passed, we originally had it set at $25. It was a fee that was just $25. It wasn't subject to the regulation of the Secretary of State. It was just set at $25. But the sponsor on the bill said, if there's a fee increase, the governor won't sign it. And so rather than argue whether it was a fee increase or a new fee or anything like that, we just said, okay, fine. And we set it at $4 because that's what the in-person was set at. And so I've had numerous conversations with the Secretary of State's office, and they are in support of the way it's drafted as proposed. And they too were surprised that it was set at $4 originally, because everyone knows you can't do it for $4. So but in order to get to tackle the bigger picture, which was to get our notary laws updated, because we hadn't updated them. We were using the 1939 version of the uniform law that we passed sometime in the late 60s. We were focusing on the minute detail of, okay, because that was not the goal. So, but now that we are tinkering with it, it's an appropriate time to fix that too. So if, you know,
I don't mean to interrupt you, Mr. O'Connell, but the question was, do you think it will discourage folks from using the remote, and would the prices affect the in-person at all?
No, I don't think it will. No, I don't think it will discourage anyone, because right now your average Maryland notary can't do it because they can't afford to do it, because it costs them more than $4 to do a remote online notarization. So really, this will allow Marylanders to use Maryland notaries to get their documents notarized online.
All right, thank you. Thank you, Mr.
Thank you, Delegate. Delegate Peña-Melnick.
Good afternoon. Good afternoon, Senator.
Good afternoon.
Thank you. We have heard a lot of concerns lately, you know, on the Senate floor about terms not defined in bills. So, you know, do you define what a reasonable confirmation means for the Secretary of State? When I look at page 6, I don't see, if I look at page 6, line 3, where it says prescribe the methods for reasonable confirmation of a tangible record by a notary public. I looked throughout the bill, I don't see the definition of reasonable confirmation.
That part of the bill, I'm sorry, Senator West, did you want to answer that?
No, you go ahead. I'm looking to try to find the language we're talking about, but you're on top.
Okay, so that portion of the bill is to give the Secretary of State the authority to craft regulations that tell the notary what to do or how to do it. This particular portion of the bill it comes from what the Uniform Law Commission is calling a pocket amendment to RELONA that allows for remote notarizations on paper as opposed to electronically. And so, there's probably, it's really designed to give the secretary control over how that process plays out. And it's a new area of the law, so it's probably not a lot of guidance on it.
Yeah, I'm not allowed to ask a second question, so I'm not going to ask it, but that's the problem here, that it's not defined. So I'm going to respect the process. Thank you so much.
Thank you, Delegate.
Do you have a second witness to answer the same question?
No, Delegate Charles.
Thank you, Mr. Chair. Thank you, Senator West. And this is kind of piggybacking off of our Vice Chair's question as far as having stuff within the bill, language. And I know we were talking about cost. And I've searched, I've put in the search engine, $25, $50 fees. And this bill says nothing about fees within it. And I'm trying to find it. Is there somewhere you can show exactly where the fees are within this bill?
Mr. O'Connell?
It's an amendment to section 18107 of the state government code. And that was really why I brought it up, because I couldn't find it online either. But if it's in the package, it's in the package.
Well, what does that have, the cost have to do with this bill then, if it's not in the bill?
Well, it should be it's an amendment to the bill. It should be, there were amendments to the original bill. That is an amendment that was made as part of the amendments. That makes sense.
Well, either an amendment was or was not adopted by the Senate, and that should be clear from the record, which council obviously has if there's some uncertainty at the moment. Okay. Delegate Bhandari.
Thank you, Mr. Chair. I would love to listen Senator West's response on Delegate Pena Melnick, Vice Chair question.
Boy, I'm having a hard time remembering the question. Oh, yes, the answer is that the bill specifically and appropriately grants to the Secretary of State the power to issue regulations which would define what reasonable, what was the phrase, reasonable, cannot change the page, but as the Vice Chair referred to some language in the bill said reasonable something, and that whole section of the bill enables the Secretary of State to issue regulations which would define what constitutes the reasonable and the other word it modifies. And that's appropriate because as time goes on, that could change. And therefore, you have the Secretary of State with the ability to modify the regulations without having to come back and get new statutes adopted every time something changes.
Thank you.
Thank you.
I have a question, Senator West. I thought I heard you say that this bill is needed because otherwise, if we don't pass this bill, that the notarized documents that were notarized remotely, during the under the emergency power would no longer be would not be valid?
Well, at least there's a question about that. So if the current statute, the applicable statute says that all wills and estates documents, they cannot be remotely notarized because the Estates and Trust section several years ago when Rolona was passed didn't think they would ever be needed to do remote notarizations. The traditional way of signing wills and estate documents is for everybody to come to a small room at the lawyer's office. The lawyer's there, the testator's there, witnesses are there, notary's there, other family members of the testator there. So you have a whole bunch of people in this room. And the wills and estates section was perfectly comfortable with that model going forward. And all of a sudden we had COVID arrive and that model just didn't work anymore. So the estates and trusts documents were excluded from Rolona, and therefore the laws applied to them and still applies to them unless we pass this bill, requires them all to be executed in person. So down the road, if documents were executed during this weird period of time, this year, maybe year and a half, or possibly as much as 2 years, until the governor's emergency declaration is rescinded, and the documents sit there for 5 years, 8 years, 10 years, 12 years before they're needed, it's conceivable, and I would say just likely, that lawyers are going to attack those documents as being invalid because they were signed remotely when the law requires them to be signed in person. So one reason why this bill is brought to the fore, and the reason why I frankly volunteered to do it last year when the executive orders were entered into, was to absolutely make sure that those documents would not retrospectively be invalidated by claims that they were not executed properly.
Okay. I will save my follow-up question for a subcommittee hearing.
Okay.
Are there any further questions? Seeing none, that concludes the hearing on Senate Bill 735. That concludes the bills before us today. Chair Pendergrass, do you have any? We have no meetings of the committee this afternoon, I believe, but please.
That's correct, Mr. Chairman. We have a chairman's meeting tomorrow and a voting session. There will be at 4 and 5 respectively, just FYI. That's the plan. Okay?
Delegate Cullison. A subcommittee meeting?
Yes, we have a insurance and pharmaceutical subcommittee meeting in about 15 minutes with one bill. Thank you, Mr. Chair.
Thank you. That concludes this hearing. Thank you all very much.